Hi, Herb Cohen. Today I want to talk about the difference between hypnotherapy and EMDR. There are really differences in these two very, very powerful therapies that are used mostly to treat trauma, addiction, and really difficult disorders like trichotillomania and phobias and uh, difficult to resolve issues like dissociation and dissociative disorders and eating disorders. So these are wonderful therapies, and the reason why these therapies are preferred over talk therapies is because of how our brain adapts to things like trauma. And what happens to that is that our memory system stores memory in a way that keeps it preserved and it's protected from being released or processed by the amygdala. The amygdala is our emotional alarm, and these memories are stored in the lower limbic region of our brain, the back part of our right side of our brain. And when we do talk therapy, we're talking over here in the frontal cortex. And so what happens is we can talk about a memory and talk about a memory and talk about what happened to us. But the deconsolidation that is needed in order to change those memories for it to be reconsolidated or not reconsolidated, as the hippocampus decides, is only going to happen if we can fully access and engage those memories by getting the amygdala out of the way. Both of these therapies share that ability. EMDR by bilateral stimulation and hypnotherapy through the entrancement of deep relaxation. So in both cases, we are able to deconsolidate memory, work with that memory within a 4 to 5 hour window we have before those memories will automatically be reconsolidated. And the wonderful thing is that during each of these therapies, we are working to create adaptive change. The mind and the brain, which wants to heal itself, we're giving it the opportunity to do that. And magically, the brain, if we prepare the person properly, that's why we have stages of preparation in both these therapies, takes the adaptive information that is preset and uses that information, and through emotional catharsis, through releasing emotions, we get to experience catharsis, and that catharsis um, creates change in the memory, and the memory's recoded, and then if it's reconsolidated as not having the same meaning or emotional content, or if it's not reconsolidated, then it will be integrated in the rest of the brain. And when we do this over and over until there's no more disruptive stored memory, we see the brain adapt again. And the adapting this time is to change back to a normal brain without the taking away the controls of emotional regulation that people experience with anxiety and depression. And this is why we can change the brain back. The brain is plastic. That's the word for a brain that can change. And we know this, and these therapies are absolutely the best way to change the brain back to its normal state, the state before it adapted to trauma and distress. So these are terrific therapies to do that. Um, there's major differences between EMDR and hypnotherapy. And the hypnotherapies and EMDR both are so powerful in working on these things that they both really are very efficient in that, because we're working with brain change and we're working with deep meaning change, we're actually doing therapy, years of therapy in just a few sessions. And I think we could say like an EMDR, in one EMDR session, I mean, we could cover 10 years of memory that have one meaning can flood through. A person's lifetime from childhood all the ways into adulthood could be processed. I mean, I'm not saying all their memories are being processed, but memories with a particular meaning will be processed in 1 hour. And that's quite an incredible efficiency of doing therapy. And it's very passive for the person who's experiencing EMDR. They're just sitting, I use buzzers, so they're sitting holding little tablets that are buzzing in their hands and watching the process go by. They're watching a movie. And initially there's some affect, but that gets desensitized, and then they're watching and they're watching the meaning change, and they're part of that process, but it's more of a passive process. In hypnotherapy, we're more engaged here. A lot of people think of hypnotherapy as someone that's in a deep trance and they're out, and that's not really the case. People are fully awake. They are in a state of deep relaxation, and in this case, they are able to engage in these memories physically and actively express emotions, and even do sensory motor and psychodrama. And not that we can't do that with EMDR as well if we choose to. But the hypnotherapy is very active and engaging and not really passive like the EMDR therapy tends to be. So there are strengths and weaknesses in both. And from doing EMDR and hypnotherapy, I really learned that there are practices that inform each other. So, for example, in hypnotherapy, we are taught always to honor and release anger and sadness, because both of these modalities serve purposes. For example, anger serves to re-empower us, and that re-empowerment is a tremendous catharsis that changes so much meaning. So we don't want to desensitize anger. And sadness is grieving, and the grieving is necessary for us to let go, and that creates another catharsis, and usually they're right behind each other. So in EMDR, now when I come to anger and sadness, I switch to a hypnotherapy technique, and I turn the bilateral stimulation off in order to allow those emotions to be expressed. But I have to say, EMDR is that desensitization is wonderful when it comes to shame and fear. So I might even be doing hypnotherapy on someone who is expressing fear and shame, and they may be experiencing that it's stuck. And I will add bilateral stimulation to the hypnotherapy session to unstuck it. And lo and behold, it releases quite quickly, and we move right through that stuff really quickly. So it's really great to have a deep understanding of both tools and use them interchangeably. There are things that are extremely different about the target sequence of the process. So in EMDR work, before I learned hypnotherapy, I would do a timeline of someone's life and look at the trauma targets, and we like to start with the earliest worst as the target. So here we are working together to agree and pre-select targets to work on. And I mean, if it's like a phobia or something else, then we kind of know what the target is, and the sequence is a little different. But in traditional work on trauma, let's say, we're going to go to the earliest worst, and that's going to pick the target. But Hypnotherapy, someone might even come in angry, really saying, I'm so full of anger. And I was like, okay, we'll do hypnotherapy because we can use hypnotherapy to facilitate the release of that anger so effectively. Yet, when we go into hypnotherapy, we are actually now surrendering to the subconscious mind. And the subconscious mind knows where we need to go to heal. And we allow that process to happen. And surprise, surprise, sometimes the person comes in and they're angry, and the target that we end up processing has a different meaning. And it's not about releasing anger, it's about getting in touch with love or a hurt or another wound. And we might not even see any anger be released, but rather maybe shame being released or some other catharsis target. And and the person, of course, feels tremendous resolve and feels wonderful afterwards because we're doing what they needed to do and not what we've pre-selected or what even they think, egoically think that they need to target. So there's something really wonderful about that with the hypnotherapy. Now, in EMDR, there's a saying that all roads lead to Rome, which means that if you start processing a target, we're going to go where we need to go. And that may be also equally so. But I don't see that really happening in the way that hypnotherapy does it. Hypnotherapy really takes us sometimes in a completely different direction or a place that we um, aren't suspecting that we're going to. And like, for example, in hypnotherapy, we can deal with energetic memory, not just physical memory. So we can go into the womb. We may end up in the womb processing, or we may end up even in a past lifetime beyond our physical lifetime, because that's where we need to learn something, or that's where we need to let go of. Um, and those have been so amazing, incredible, powerful, powerful experiences. So there's just that kind of difference there with the hypnotherapy. But I have to say that EMDR's strength is in the desensitization. And when you apply that to addiction memory, there we're actually flicking a switch because we're working directly with implicit memory. We know that. And I watch the process, and it's just amazing. Like, in 30 to 60 minutes, you're watching someone switch off their chemical dependency. You're seeing their cravings desensitize, their high desensitizes, everything about their addiction desensitizes. It's just, it's really an incredible process, and there's nothing that seems to work better, I find, than using EMDR for that. So I've used both for eating disorders, and eating disorders are just so much more complicated, and I'd have to do a separate video to talk about eating disorders, but uh, I throw everything I have at eating disorders, so I use both tools. So if you're choosing, you have to choose between a hypnotherapist and an EMDR clinician. I think the important thing is, now you know from watching this video that there are things that we shouldn't desensitize. Like, we shouldn't desensitize anger and sadness. So you can tell that EMDR clinician to turn the bilateral stimulation off and to help you facilitate the release of those emotions. And we have been trained to do that in hypnotherapy. So if you have a lot of anger and sadness that are part of what it is you're suffering with, or that you feel is pent up inside and you need to release, like, for example, if you're grieving a loss, there's going to be some anger and a lot of sadness, then you might choose a hypnotherapist. If you are going to an EMDR therapist, and you have a lot of fear, that would be a good choice. Fear and shame are wonderful things to desensitize, and EMDR is the therapy to choose for that. It does a great job of desensitizing, and it does it easily. And this is just a top line therapy for fear, as far as I'm concerned. I really think it's a master therapy for fear, dealing with fear. Sensory motor therapies, physical therapies can be easily integrated into each of these modalities. Each of these modalities can be integrated into each other. And isn't that wonderful that we can do that, that we can enfold these tools into each other, and they can, that's the real beauty of these therapies, is that we can do so many things with each of these tools. So if you're struggling with addiction, with eating disorders, with anything that's stuck, anything that's difficult, that's not making progress with cognitive therapy or talk therapy, then you need to go to a more advanced therapy. And those include the hypnotherapies and the EMDR type therapies. Um, EMDR and hypnotherapy both have certification levels, which denote a more experienced therapist. There are even more advanced levels beyond certification as well. So, in each of those domains. So, when you're researching therapists, I would recommend highly that you go with someone who is experienced, because and maybe not so much a part-timer doing that. A lot of therapists who have large talk therapy practices will study hypnotherapy or EMDR and then do one or two people here and there, and they're not really versed in the skill set that's needed when you go deep in these therapies. Um, they're holding a huge responsibility in working with you in these therapies. So it's really important you put yourself in good hands. So I hope that answers most of the questions. I think it's answered most of the questions that come to me about these two therapies. And a lot of people do want to know the differences between the two. And they really are very different therapies. Although in my office, they're kind of becoming more integrated as I'm using all the tools available when I need to. So if you have any more questions about these tools, do contact me. My contact information is on my website, which is herbcohen.one. And again, this is my video channel at YouTube, and that's Herb Cohen Flow. So stay tuned, and I'll see you at the next video coming up.